Good morning, everybody, and happy Monday. This is Claudia Maragno, producer of Smile&Shine. Today, we will be talking about a very interesting topic, which is medical and scientific disinformation. In other words, we found out that there are so many fake news in the world of science, and we would like to talk about the way the international scientific community has addressed this big problem and how managed to control this phenomenon. In fact, last February 2022, at the Universal Expo World Fair in Dubai, there was a meeting that was supported by 71 scientific societies in the field of phlebology. That has been recognized by the Communication Coordination Committee of the United Nations. A review article that has been published in April 2023 has been talking about a communication that is free from fake news and is evidence based for the management of venous and lymphatic diseases. So, scientific evidence has shown that there is a lot of misinformation and disinformation that is linked to health information, to health news, both on social networks, but also on non official communication channels. They have been this joint international work had shown how 40% of websites are actually reporting inaccurate information about lymphatic and venous disease, and the serious problem is that this information is spread and shared up to 450,000 times in a time frame of 5 years. So it's a real problem that is particularly evident in the specialties of infective diseases, oncology, and cardiovascular disease. So the document that we will be presenting today is the result of a big effort, both scientifically speaking, but also educationally wise, because we are talking about a global group of experts and scientists that have been selecting and analyzing the biggest problems and facts that are associated with the management of venous and lymphatic diseases. Everything evidence-based. Evidence-based will be the key word of today's interview. The word that we have been producing includes a written part that is targeting the layman, the person that is not expert in the field. But there is also a part that is addressed for specialists, doctors, and includes systematic literature review, summing up everything in a very clear way, of course, evidence-based for the management of lymphatic and venous diseases, also suggesting new topics for future research. This document has been written thanks to a big interaction that have been taking place internationally, thanks to different groups of doctors working in different countries that have led to an institutional official presentation during the Universal Expo in Dubai for the Winter 2022 meeting. So if you want to know more about this fake news topic in the medical field, stay with us after our theme song. welcome back to Smile and Shine. Happy Monday to everybody. This is Claudia Maragno, producer of Smile and Shine. We are here connected with Professor Sergio Giannesini today that will be talking about fake news in the health sector and specifically in the vascular and lymphatic diseases area. A brief introduction of Professor Giannesini. He boasts a degree in medicine and specialized in general surgery, in urgent general surgery. He subsequently completed a PhD in pathophysiology and is adjunct professor in surgery at the Bethesda University in Maryland. He's currently working as a clinician in Abu Dhabi. And also, we have to mention, of course, that he is president of the Global Society of Phlebology. Professor Giannazzini, good morning and welcome.
Good morning, Claudia, and also good afternoon, good evening, because we know that all the world is following you.
We are so happy to have you here today, and thank you for finding a little slot for us. We really wanted to find some time to interview your really remarkable initiatives that you're doing in the field of phlebology. So I would like to start with the first question, Professor Giannesini, based on the article that we were mentioning before during the introduction. What do you specifically did during the Universal Expo in Dubai on the topic of fake news?
So, Claudia, the Universal Expo, the World Fair 2022, had a very clear mission statement that was connecting minds, creating the future. So we did that on a healthcare perspective, by connecting the expert to properly inform the patients. Now, I deal with one of the most democratic conditions you can find, that is lower limbs or legs, veins, and lymphatic disorders. And if you really think about that, you are not going to usually find varicose, bulging, dilated veins on your arms, but on your lower limbs, because we evolved from quadrupeds to bipeds. So we are overwhelmed by the force of gravity and also by a tendency towards sedentarism, obesity, and also aging of the general population. So what we are going to talk about today is potentially of interest for at least one follower out of two of Smile and Shine, because in reality, 50% of the population might be affected by some lower limb aesthetic concern rather than varicose veins, rather than even skin ulceration that are associated with this vascular condition, or the so-called hidden epidemic, so swollen limbs, where like females in particular thinks they are just obese. And if you really think about that, you have these kind of females with big legs, but then a very slim trunk. They are not obese, they just are affected by lymphatic disorders, and also more technical aspects for issues at the abdominal level with the female varicocele. Now, everybody knows about the male varicocele because you can see it, because the genital part of the male is visible, but in the females it's exactly the same thing that is not visible anatomically. So you really have one woman out of three suffering of pelvic pain during sexual intercourse, not reporting that, but actually having it, and in a too high percentage of cases not being properly treated. So the aim of this project was exactly this, bringing real evidence on what is evidence-based compared to what is fake news. As you said, the numbers are impressive. The World Economic Forum reported that fake news has been one of the top 10 issues humanity has been facing, actually. So that's our responsibility to reach out to the population, also thanks to the great collaboration of Smile and Shine in this mission.
We are absolutely proud and happy to have you here today and share to a greater audience all this interesting information about fake news in the field of medicine. So the after the following step in this process has been in 2019, where the scientific community have has gathered, and you decided to analyze which were the similarities and the differences among different guidelines, and you actually found that not all guidelines are evidence based. Can you tell us a little bit more about this topic?
Yeah, well, it's not something I found to be evidence-based. Actually, a colleague named Garcia pointed out in a previous article something very interesting, that one recommendation of the guidelines out of five gets outdated every 3 years. So the first problem you have with these guidelines, and talking with non-experts in the healthcare professional field, basically are like the documents that are telling us what we should do in the diagnostic and therapeutic process. One issue is the one of the fast aging of these recommendations, so we have to catch up with time. But at the same time, we have to catch up with the space, because all around the world, these guidelines should be properly written, meaning that there is a specific methodology that is leading to the creation of these recommendations. Unfortunately, sometimes, but not so rarely actually, for what we found, these so-called guidelines are not real methodologically perfect guidelines. They're more like consensus documents and such. This leads to quite a discrepancy between the different documents. I give you an example. For example, today, in 2023, actually, than the previous year, we had the American guidelines, also called guidelines, suggesting us to prefer one technique to another for treat the venous disorders of varicose veins, and in Europe, a little bit indication. So how is that possible? Methodological mistakes, political preferences from one group to the other. So that's very important in a globalized world that we have a teamwork to properly come out with sound evidence and sound related recommendations.
Great, absolutely great. That the work that you're doing is absolutely remarkable. And the subsequent step has been in 2022 to actually verify what was fake news and what was not fake news. For example, analyzes the published consensus available, the guidelines, but also the evidence based data. And these has led to the production of a document, a 100 pages document that is targeting both medical professionals but also laymen that are eager to know more about this topic. What about this document?
This document is open access, so everybody can enjoy it for free. You just visit the www.foundation.com webpage, or you can also go in PubMed, that is our scientific Google for identifying a proper literature. If you are an healthcare professional, as you said, you can enjoy 100 pages divided in 12 chapters on the different main areas of veins and lymphatic disorders. But also, if you are not an healthcare professional, you can download a booklet of 12 pages summing up the 12 different chapters in different languages. Even more important, the fact that you can report eventually encountered misinformation. So you might be a healthcare professional who wants to highlight that something that is not appropriate is out there in the web. Or if you are a patient or public, you can eventually ask us if what you found is really reliable or not. We have been very impressed negatively to see how many websites effectively in the venous and lymphatic disorder field are suggesting, for example, topical creams that can do miracles that in reality, of course, then do not happen, or colleagues even proposing strategic actions that are not so strategically well placed for varicose veins treatment, for example.
Thank you, Professor Gianzini. Stay with us after this brief video that will be talking about fake news in the world of medicine and specifically in the world of phlebology. See you in few minutes. Stay with us.
How not to build a dystopian world in which misinformation on the web is guiding public awareness in terms of health. This was the topic focused on venous and lymphatic disease for the lower limbs. We developed during the Universal Expo in Dubai in 2022, leading to a significant publication of 100 pages for experts, translated in layman terms for the public in different languages, involving 71 institutions and 83 countries. Starting from something impressive, 40% of the medical websites, including fakes, shared 450,000 times over a 5 years terms of observation, according to a publication that came out in a very serious journal on the topic. This effort of ours was recognized by the Communication Coordination Committee of the United Nations as a significant, because indeed it touches the significant topic, according to the World Economic Forum, of misinformation, or actually fake news spread. This goes with the vertical reliability loss, so the fact that we stop relying on the biggest experts in the field in favor of the horizontal misinformation, that is the fact that everybody on the web becomes an expert. Basically, this is an issue even for the university, because we have so many fakes university, as you can see. For example, in India, 24 fakes that are there with the name of the university that actually is not a university. This is why groups like Facebook are engaging in the creation of working groups to counteract misinformation on the social media, understanding that 1/3 at least of the population is on the social media, and in the social media they are seeking for information rather than from the official sources. You see, for example, 67% from Facebook getting news from there rather than from the official sources. But let's not make the mistake to consider this as a modern issue. This goes back in time. You see, 1688, they were already talking about false news dissemination, even if, according to the UK parliamentary group on the topic, we should not talk about fake news. We should not talk about, we should rather talk about misinformation, disinformation, and malinformation, with malinformation being done on purpose to create harm and misinformation done unintentionally. Our priority, of course, is to protect the patients, the public, from misinformation in healthcare, and this is particularly true for us from the cardiovascular field, because we are already at the podium, at the third you see place there, with the first one being infectious disease as the most affected by misinformation, followed by oncology, so tumors, and then us with cardiovascular. The fact that infectious disease is particularly exposed to misinformation was clearly evident during COVID time. We know that rather than just a pandemic, it was an infodemic, for which, once again, particularly in the venous lymphatic field, we have to take care, because during COVID there was a lot of misinformation about the thrombotic management associated with COVID spread. This is true care, that is together reporting unbiased education, so delivering proper education in an evidence-based way among experts, reaching out to the colleagues, but also to the public, but also talking about the certification and regulatory education, so the importance of having a proper controls on the device, drugs, and products we use. Engaging not just the experts like the venous lymphatic field ones, but also family doctors, public, and patient. Now, when we're talking about certification, it means being sure that the products we have in our hands are properly certified. If you go to the airport shop, for example, for stockings, you will not find usually certified products. This is very bad, as it is bad when we have sport products like this one, claiming that they can improve blood circulation without having a real study behind that. There are products for compression that are, of course, extremely helpful and that can provide the benefits, but usually not the ones you can find in commercials like this one, that really they require proper validation. The same thing is for the devices we are using in our medical field. Some of them produce heat, some other not, and there is quite a discussion now in in our community about who's best. And it's very important to understand that it's not just about getting into the market, it's also controlling the post-market surveillance to make sure that we keep track of the good management of the disease and the use of proper devices, because innovation is, of course, important for improving healthcare, but at the same time, the problem is that proper validation must be there. Now, with 95% of the innovations coming from the small to medium companies, it's quite difficult for them to keep track of the performance a long time. And indeed, we have more than 2,000 files of notification for malfunctioning of devices in healthcare, and in 44% of cases can lead to severe consequences. Then in one case or two are related to the cardiovascular system, therefore us. That's why it's very important that we develop these kind of projects, not just for the devices control, but also for the claimings of the different strategies to treat, in our case, varicose veins and venous lymphatic disease in general. This is, for example, a commercial of a colleague website. I'm not going to say who, of course, but clearly I will say what. We should never write things like vein are strengthened because there is no evidence about this. So careful in what we are reporting out there, and careful in having this will of being the first one doing something in a country. That's a typical commercial of colleagues saying, "Look, I've been the first one in my country doing this." Well, also Franz Richel was the first one jumping out of the Tour Eiffel with a brand new parachute that did not open. Therefore, let's make sure that we don't just have claims, we have to look for proper validation, proper publications, as per the medical device regulation laws that we have now in Europe. The same thing for the different products like pills and creams that we can find too easily in the pharmacies and that we take for too long before actually going to the specialist, potentially creating also harm to our health. This is a legal issue that we have to be brave enough to bring to the surface, not just talking behind closed doors, because there are too many commercials as these ones, as we know, where we have a vein that is disappearing just by applying a topical cream with no need, according to the commercial, of talking with an expert. We have to protect indeed our patients as experts from navigating in a web of misinformation that could be extremely dangerous for the healthcare, for which we created this portal where you can report eventually encountered misinformation or ask for suggestions on the topic. 50% of us are affected by chronic venous disease. That's the natural price of evolution because we are overwhelmed by the force of gravity. So it's very important we all recognize conditions that are ranging from spider veins, so little aesthetic concerns on the leg, all the way up to varicose veins, and then all the way up to even a skin ulceration caused by this venous hypertension on the skin. It's very important we just don't go to doctors who are just removing veins without proper evaluation of the system, where we can eventually close the leaking points, not ablating all the roads we have back to our heart. And it's also important to rely on specialists because we have conditions in which you can maybe not detect a reflux at the ultrasound, but because, for example, of obesity, you're going to have a venous hypertension that is not detectable by the machine. And last but not least, it's also important to consider that not always you have symptoms. So even if you don't have symptoms, you might have the need of being treated for a microcirculation issue that might be there, or a macrocirculation that is not giving signs or symptoms. 2%, though, get to the most evident condition, that is the one of the ulcer, which is something that is leading to a cost for the healthcare system that is, again, 2%. So it's also a responsibility for proper healthcare management. And of course, for stopping the leading cause of preventable death. And I say again, it's preventable, so we can prevent it, we can help managing this condition that is affecting not just the main rivers that are the veins, but also the little creeks that are the lymphatics, for which many females, for example, are feeling fat, while in reality they are just overloaded by fluids. This is the hidden epidemic of lymphedema, as defined by the World Health Organization, either because many patients are affected indeed by lymphatic issues without knowing that, they just feel they are fat. And on the other side, the gender equality topic of pelvic venous disorders, for which a pain in the lower abdomen, sort of constipation, sort of pain during sexual intercourses, that is actually more frequent than asthma, but not everybody knows about that because it's the similar condition of the male varicocele. But the male varicocele is evident anatomically on the scrotum. In the woman, for the anatomy, is inside the abdomen, so it's not visible. Yet 1 person out of 3 among the women can suffer of pelvic pain that can be associated with this condition. You understand now why we use this image in our vein week, the awareness week we have for venous disease, of the quadrupeds becoming a biped. Then now we are even more sedentary than before, which means that we are even more overwhelmed by the force of gravity. That's why I really thank Dr. Malagno for being involved in the communication campaign related to these conditions, and also in the real-world data collection and real-world data dissemination, as we are doing with a major project called VIA Registry, that is indeed associated with a proper analysis of data that will be presented after 6 months in a beautiful Bali island at the antipodes of Italy, but with an Italian heart, because indeed this global organization is starting from Italy, where you are then all invited to join, also for a humanitarian mission where healthcare professionals and non-healthcare professionals can take part and give help to treat at best the patients, and at the same time to enjoy 3 days of scientific divulgation in the beautiful, once again, Bali Island. So see you in Bali, if you like, next October, and I remain at your disposal for whatever further information.
Welcome back to Smile and Shine, broadcasting every Monday at 11 a.m. Eastern Standard Time. This is Claudia Maragno, producer of Smile and Shine. Today, we will be talking about fake news in the field of medicine, and with a very special guest, that is Professor Sergio Giannazzini from the University of Ferrara, Italy. He's president of the Global Society of Phlebology for the tenure 2023-2027, and he will be talking about disinformation or misinformation in the medical field and in the scientific field. Professor Giannazzini, welcome back. We would like to talk about an event that you are organizing in Indonesia to actually show the importance of real-world data. In fact, you will be presenting not just scientific studies, but also quite a few analyses that are showing what is really happening on the population. Basically, you have been creating a global record of data that allows doctors worldwide to cooperate with patients, but also giving data daily, both on the symptoms, but also on the management of lymphatic and venous disease. What is this global record of data?
It's a register. It's called the registry. So basically, the registry is allowing you to collect a lot of data that are called real world data. The typical example is the one of the parachute. If we have to demonstrate in an evidence-based traditional way that the parachute is going to save our life when we are jumping out of a plane, we should take one group with the parachute, one group without the parachute, and see how many will survive in the 2 groups. Of course, this does not happen, and sometimes in medicine it's the same. It's not always easy to reproduce the real world scenario. There is a very nice publication that came out that is called the 32 RCT initiative, that is showing in 32 different studies that are randomized comparative trials how many times we really do not overlap the real world scenario. So it's very important, of course, to keep the evidence-based traditional trials, but also combine them with the real-world evidence. To do that, we need tools, and up to now, up to our knowledge in our field, the tools we have are not really fulfilling all the needs that we have in terms of eliminating the confounding factors. Now, this is very technical, but what I mean by this is, take for example, Claudia and Sergio as patients who have to be analyzed for a drug that we have to take. Maybe Claudia is used to go to the swimming pool twice a week, so her legs are feeling great. While on my side, sitting down all day, eating and becoming fat. Now, this is going to have an impact on our results in the study, for which we have to consider also all these different lifestyle aspects and other confounding factors that could come in the game. For this, we created this tool that is available in different languages and whose results will be presented indeed in Indonesia next October 22-26.
So thank you, Professor Gianzini. So for anybody who's interested in knowing more about this event that will take place next October in Indonesia, you can visit the website www.sergiogianzini.com and you can connect with Sergio Gianzini team to just register to the event. And thank you for letting us know about this global event in the field of phlebology. So, Professor Gianzini, regarding the management of undertreatment and overtreatment in your field, we know this is a hot topic. Which are the studies that you have been conducting just to provide to the patient a customized and tailored type of approach to address venous and lymphatic disease?
This is a splendid question that would require really hours of discussion, because there are different fields in which you might have an over-treatment, for example, the tendency to over-treat in this moment, or under-treat the deep venous disorders and the pelvic venous disorders. But as you're referring to the hemodynamics in particular and the tailored treatment for chronic venous disease, I guess from your question, what we can use as a metaphor for the public is the one of the highway. Let's imagine that the entrance to the highway is presenting some issues at the gate that is not opening well, like, for example, a valve of the venous system. Well, in that case, you would spontaneously try to get into the highway at the next available gate. Basically, it's the same thing we can do in varicose veins management, rather than removing all the highway just because there is a gate that is not working. We can redirect to the next available gate. Of course, to do that, we really need a proper analysis of the hemodynamics of our patients to make sure that we are choosing the right gates. And for this, it's fundamental to have a correct diagnostic approach by clinical, but also by echocolor Doppler expertise.
Thank you, Professor Gianzini. We have a last question for you, and is regarding, we know that you're really, really scientifically prepared, and your scientific work is well known worldwide. But your activity also has a human aspect. In fact, you are really active socially wise by an organization that is called V Help. You are in fact organizing missions, humanitarian missions worldwide in different countries, both for the management of venous pathology, but also for training doctors in different countries. So, which kind of projects are you conducting at the moment via VHelp, and how are you helping the global community through this organization?
Thank you, Claudia, for mentioning one of the projects that are dearest to us because of the humanitarian, as per the first letter of the acronym HELP, but also for the education as per the second letter of the acronym, because indeed it is PWIN, humanitarian education in phlebology. So the project here is not just to provide the fish, as we are used to say in the metaphor, but also to teach how to fish. So in the next experience we will reproduce what we have been doing around the world many times now. There will be not just offering free medical services to advanced stages of venous disease, but also to collaborate with the local realities to increase the educational aspects on the topic. And everybody is invited. You are, of course, also a healthcare professional, also but a great communicator, of course, as you are. So you are invited in both versions of Claudia, as Claudia, the Smile&Shine nice representative, but also as Dr. Maragno. But everybody, even if you are not healthcare professionals, you can join and share some humanitarian moments together, just helping the patients right after the procedure, for example, or in the organizational and everyday aspects of the mission.
Thank you for the invitation, Professor Gianzini. I hope to be there in Indonesia next October. The message of today's interview is that misinformation is involving also the medical field, is a worrying problem, of course, but the scientific community is acting fast to tackle this phenomenon with big projects, global projects such as the real world data. We remember that is a project that gives information real time on the symptoms and also management of venous and lymphatic disease, creating a global network of data that could be shared real time. So the hope is that this very, very ambitious project can be just the beginning of a journey globally, and that we can extend this kind of project also to other medical fields. Maybe Professor Giannesini could be a mentor in these. Thank you, Dr. And Professor Giannesini, for being with us today. And thank you for our audience. See you next Monday for a new interesting event of Smile&Shine. Same time, same place. Thank you for everybody, and see you next Monday.
Thank you so much, everyone. Thank you so much, Claudia.